What are you waiting for? What are you waiting for to absolutely change your life and to get off of the cycle of the constant yo-yo dieting and putting a Band-Aid on the disease of obesity? That's what we are delving into today. Hey guys, welcome back to the channel for another video. If you're new here, my name is Brittany. I have lost 95 pounds now on Mounjaro, tirzepatide, Zepbound. I use them all interchangeably since November of 2022. And here on this channel, I love to share all things GLP-1 related, personal experience stories, my own personal journey, and that and so much more. So if that would interest you, I would love to have you subscribe, stick around, and hang out with us for a little while. As always, first off, leave me down below how you are moving your body today and what your small win of the day is. I love to see those. They motivate me so much when you guys comment and are like, I'm gonna go on a 5-mile walk. And I'm like, oh, well, maybe my 20-minute walk wasn't sufficient. And so it really helps to motivate me, and I'm sure it motivates all of you guys as well. I'm gonna walk on my walking pad as soon as I am done with this video, as soon as I'm done filming it. So I need to get that going so I can have enough time to walk before my niece gets here. So let's just delve into this. I am somebody who is so much an advocate for mental health. Okay. I have had my own personal struggles in life through childhood trauma and all of the things that come along with it. And one thing that I think that is starting to get noticed with all of these people losing weight on GLP-1s is the total mental aspect and the total mental sort of shift that your brain goes through when you lose a large amount of weight. And so this podcast that I'm sharing with you guys today was actually done, it's actually an Oprah podcast. Now, Oprah is not typically my super big cup of tea, okay? I like her, she's okay, but it's not a podcast that I typically listen to. However, it was recommended to me, and the title of it, speaking about what happens after and how people might treat you differently, sort of drug me in, and I decided to give it a click and try it out, and I was hooked immediately. And so if there was one thing you take from this video, go watch that, or listen to it, or watch it on YouTube. That episode, she had some amazing experts on there, some amazing personal stories. I'm gonna go over some of them with you, but y'all, when the title of this video says life changing, and that is exactly what that podcast episode is. It's going to make you so many things click, so many aha moments in your brain when you listen to it and you hear other people saying things that you are feeling as well, and maybe you just haven't had the words to voice them out loud. So what are you waiting for? Let's delve into it. So the first person that comes on this podcast is producer Brian. And Brian is actually a producer for Oprah and has been with Oprah for many, many years, 20 plus years now at this point. And he has always been severely obese, 300 plus pounds. He mentions throughout his little section on this that he would eat 3 desserts, and he would find himself, say, the example he gives is, say, if somebody had brought donuts into the office, he would eat one donut, and then he would figure out how to sneak a second donut, and then he would have this fight in his brain about how he's going to go get his third donut without people noticing. And so that was something that he said that he did quite often. And at the time of the original Oprah show about shame, blame, and the weight loss revolution, or whatever that was called, about a year ago, producer Brian said that he was scared of mourning the loss of food and scared of the side effects that may come with being on a GLP-1. And I think the whole aspect of mourning the loss of food is really important. I think that's something that holds a lot of people back, because food is such a comfort for humans, for Americans, for people in general. And producer Brian was scared of that going away, of not being able to enjoy the foods that he once loved, and so on and so forth. And so one thing that he specifically pointed out is that GLP-1s did not take away the enjoyment of food. It's just the fact that you eat less of them. And I would 100% agree with that. So I wanted to touch on a few things that producer Brian said that I feel like are such an important conversation to have. So throughout many times in his life, he had lost several pounds, 50, 60, 70 plus pounds, and had gotten down to what his body referred to at, or what his set point. And he said that every time he would lose that weight, he would feel empty inside. And that is something that I specifically can 100% relate to. The feeling of emptiness when you lose all of this weight, but you haven't addressed any of the mental aspects, and you haven't really corrected, you just put a Band-Aid on obesity. The feeling of, well, I worked so hard for this. I've been starving myself and, given up everything that I enjoy and love in life for what? What did this get me? And then he would eat the piece of cake because I worked this hard and I deserve a piece of cake, and YOLO. And so then it would be this yo-yo diet cycle of him being heavy again, losing more weight, heavy again, losing more weight, so on and so forth. And so now that he has been on a GLP-1 for a while, he has lost over 70 pounds, more weight than he ever has before. And he really speaks to the effect of, it didn't take away my enjoyment of food, and I don't feel empty inside anymore because I feel satiated. I don't feel like I'm missing out on anything. I'm not having the cravings through the decreased food noise. He's not having the knee pain he once was. One thing he touches on is extreme the inflammation help that these GLP-1s offer you. And he says that within a week, his joint pain, his knee pain was gone. I can attest to that as well. I suffer with several inflammatory type of issues, one being the knee pain, another being carpal tunnel. And carpal tunnel is more of like the joint itself being messed up or whatever. But since I've lost weight, I don't have the pressure on my carpal tunnel joint as much, and so I don't experience that as much. And so the inflammation property is one that he really touches on. So he sort of starts the episode out and opens up this conversation for so many others to come on. And I think that having him start the conversation was so great. So now we're going to get into some facts. So Dr. Anya, there's two doctors that she has on within this episode, Dr. Anya and Dr. Rachel. Dr. Anya is actually an endocrinologist and associate professor at Yale School of Medicine. So great, Dr. Anya, you're great things. And then Dr. Rachel is a clinical psychologist in New York. So again, very highly educated clinical providers that can offer some great insight on this. Now, in a recent survey, 1/2 of all American adults said that they would take a GLP-1 or that they wish to, or it's something that they are considering. However, only 12% of American adults, which I still think is a lot, have actually been able to access this GLP-1 medication. And so Dr. Anya comes on and speaks about the benefits of these obesity medications in terms of all of the other diseases that are counterparts to obesity. So there are over 200 obesity-related health conditions that can be improved or cured or put into remission through the weight loss process. Several of those types being cancer. There are specific types of cancer that we know are related directly to obesity. Postmenopausal breast cancer, endometrial cancer. There was another big one that I wrote down, and now it's blanking on me here. Nope, that's what I wrote down. Colon cancer. Okay, that was the other one. And colon cancer is something that I have a very strong history of in my family. So direct responses to cancer, direct responses to PCOS and stroke and heart attack. And one thing that she touches on is the fact that it's a twofold system. So GLP-1s help you to lose weight, which decreases your chances of developing these diseases and also helps improve your disease processes if you already have them. But also several different areas in the body contain GLP-1 receptors. One of them being obviously your brain, because food noise. Your heart contains GLP-1 receptors. Your tongue, like your taste buds, which is why a lot of people say that it can alter your taste buds, have GLP-1 receptors. And so the GLP-1 receptors are working directly, like say for instance, on your heart to minimize your risk of heart disease and heart failure and all of that. At the same time, you're losing weight, which is also helping to minimize your risk of heart disease and heart failure. And that is such a wonderful thing. And so that is something that Dr. Anya really touches on in this episode, which I absolutely really love. So she does offer some, factual based evidence on these things and how they can transform our lives in more ways than just with weight loss, right? More ways that these medicines are working within our body to help slow or stop different disease processes. And so then Oprah goes into speaking to several different people throughout the podcast who have either were on her previous show, people that weren't on her previous show, and they really go into this absolutely great discussion about mental health and how it is affected after weight loss. And that's what I wanted the bulk of this video to be on, because again, I am such an advocate for mental health. With somebody who takes an anti-anxiety medicine and has been through some severe childhood trauma, I am very passionate about this topic. And so when I was listening to these different people coming on, which I'm going to touch on, I was relating so much to every single person, and they were saying things that I never would have given words to or would have thought how to give words to. And so it is so beneficial to listen, especially to the second half of this episode, and hear these things that are being said, and then hear the doctors come on and give justification medically to these things and to these thought processes. So I'm getting so excited about this and I'm like drying my throat out. So the first person that comes on is a young lady named Michaela, who has lost 167 pounds. Like, come on, girl, you are rocking it, through both bariatric surgery and through weight loss medication. So she had bariatric surgery first, realized that that did not fix the problem because it did not alter her brain, and now is on Zepbound. So she goes into her entire story. She said she was named the fat cheerleader in high school and pretty much was overweight, obese most of her teenage and then young adult life, and kind of goes into that whole background. But the fun thing that I think she mentions, and the thing that she really adds to this podcast, is when she starts speaking about the doctor that finally did help her and what that doctor said to her. I've said a million times before, that it is so important to have a good supportive doctor. I'm not looking right in my eye. That it is so important to have a good supportive doctor in this process, because somebody that knows what they're talking about, somebody that is willing to learn new things about GLP-1s. So what Michaela's doctor said to her was, this was after she had had bariatric surgery. She had tried all of the weight loss things, right? All of the same things that we've all tried in our life. And she goes to her doctor and she's like, I just can't, like, something's wrong. Like, I just can't do this. And her doctor said to her, when are you going to stop blaming yourself and accept help? When are you going to stop blaming yourself and accept help? And that was something that was just absolutely like boom in my brain, because for so many years, I, like many of you, I'm assuming, spent dieting and Weight Watchers and the freaking soup diets and low carb, high fat, low fat, whatever, all of the different diets, calorie counting and restricting ourselves that we've tried that never worked, that just, we would lose a few pounds and then we would gain more weight back. And we were blaming ourselves, like, what's wrong with me that I can't do this? And the fact is, there's nothing wrong with you that you can fix yourself. If you truly have the disease of obesity, you can't do it yourself. And that is such a aha moment. Like, it's not you. You're not to blame. You're not the failure. You just need help, and you need the right help to help you tackle this. You know, you don't blame somebody with high blood pressure for not being able to control their blood pressure without medicine. That's not a thing that we do. And as the obesity sort of science and research into obesity sort of continues to evolve, we are going to have a lot more understanding of obesity as a disease and how it's not something that the people that truly struggle with it can control on their own. You don't control, for the most part, anxiety, depression on your own. Most people need help through either medications or through therapy. And so to think that for all the years that so many people struggled being told, you know, just move your body more. Oprah said in the podcast, we just need to steam more broccoli and move our body more. And we were told that for so many years. And now to have the validation in, we're not crazy. It really is impossible to do on your own if you truly have this disease, is absolutely like mind-blowing to me. And that's something that Michaela said in this process, and that I just was absolutely like enthralled with. And something that Oprah added to this is a statement that if this is something that you could have fixed, you would have. none of us have wanted to be fat our whole lives. If this is something that we could have changed, we would have changed it. And that is so important for so many of us to hear. What are you waiting on? If you are somebody that has not taken the plunge to Zepbound, what are you truly waiting on? Because if you could have changed it, you would have done it. And that's just facts. For every single person that has ever struggled with being overweight, if we could have, we would have. That was like the most powerful thing that I feel like she said in this entire episode. And so then it goes into several, like I said, several different people on there speaking. But the next big thing that I wanted to talk about was what they said about friendships. So throughout the journey of losing weight, we start to change, right? Like our body changes, our mind changes, our outlook on life changes, our confidence level changes. And with that, our friendships change. For so many years, this is something that I personally have noticed. For so many years, we were the fat friend, right? We were the one who would go to the bar with our skinny girlfriends and they didn't have to worry about the guys hitting on us, right? They didn't have to worry about us stealing attention from them. They didn't have to worry about any of that. And now that the dynamic has shifted and we are living this life where we are more confident and more willing to talk to people and flirting. I mean, if I'm not flirting out in real life, if you're not married, there has come that a lot of people have noticed this shift in friendships where people that were previously supportive aren't anymore. And you wonder why. Why did you like me? Why was I invited to things when I was 80, 90, 100 pounds heavier? And now I'm not being invited to them. It's because there is this dynamic shift within friendships that Dr. Rachel really touches on in this video or in this podcast, where the people, everybody, like you're seeing yourself differently, but they're also seeing you differently. And maybe the friendship that you had once with those people served its purpose during that time in your life. And maybe that person, those friends aren't of the confidence level and self-assurance level to handle you at your best. And that is just an unfortunate side effect. There's been many people that have come out and talked about friendships that they have lost. But I want to say this as a big but. All of the friendships that I have lost weren't for me. And the friendships that you most likely will lose won't be for you, or they won't be for you in this time in your life. And that's okay. And so we're mourning the loss of who we once were while also blooming and flourishing into who we're supposed to be and who we could have been all of these years if we didn't have this disease holding us down. And so with that comes some loss of friendship. But that's okay. And that's what Dr. Rachel, the psychologist, says, like, that's fine. Again, those people weren't meant for you. And so you're going to find the people that are meant for you. And is it okay to mourn those people? Absolutely. Is it okay to question why you're not good enough now? Yeah, of course. But the progress that you have made in yourself and the changes that you have made in yourself so outweigh the loss of the friends that obviously weren't meant for you in the first place. And so I think that's really important to note. With that being said, Dr. Rachel talks about the comparison between bariatric surgery and weight loss medicine and the fact that bariatric surgery, when you go to have bariatric surgery, you're actually required to get mental health services. I know this personally because my mom had bariatric surgery, who, fun fact, is now on tirzepatide. And she speaks about how that is something that is missing in the current GLP-1 space, is the requirement for some type of mental health. Because there are, when you go and you have bariatric surgery and you have a mental health evaluation and a few visits with a psychiatrist, they go over a lot of the changes mentally that could happen to you or are going to happen to you when you start to lose a large amount of weight, and when you start to see yourself different and people in the world start to see you different, and how your mind is going to react to that. They go over most of that with you. However, there are so many people now that have been, now we're 2 years into this whole GLP-1 thing. There's so many of us that have lost significant amount of weight. So we're now noticing all of these mental health things, and the fact that people treat us differently, and the fact that we think about ourselves differently, or that we think about life differently. And so she is really advocating for that, for the bariatric mental health type of thing to transfer over into GLP-1 use. And I do think that that's something that could come the longer we are developing GLP-1 medications, the more doctors are learning about it, so on and so forth. She also stresses the need to find a good provider, which I mentioned, earlier in this video. There are a lot of primary care doctors who either don't know enough or haven't studied enough, or just aren't in the right mind space yet for the treatment of GLP-1s. Haven't treated enough patients, haven't seen it enough, haven't cared to learn enough. And so one of the guests speaks about how she went to a weight loss doctor who put her, okay, so I can tell a personal story for this as well. Many years ago, after I had my middle child, I went to a weight loss clinic here where I live, and I paid a couple $100 for this visit. And I went in, and essentially the doctor went over this crash diet. I mean, he basically wanted me to eat no carbs, chicken, salads, like no fat, no carbs. Basically was like, you need to eliminate all this stuff from your diet and take these pills, which were phentermine, and you'll lose weight. And I lasted on that for about 4 days before my body was like, hell no, this is not the way. And so Dr. Anya comes on and talks a lot about how a lot of obesity doctors, and what the climate in that space was before, was that low carb, phentermine, you'll lose weight, right? And so it's shifting now to be more of the GLP-1 use and the much healthier way to manage and gauge weight loss in the obesity disease population, right? And so one thing I want to say is, if it feels wrong, it probably is. If the relationship feels off or feels wrong, it probably is. You need to find somebody that is supportive to you, not just as your provider, but also a good support network. I love the support network that I have found here on my YouTube channel, on my Facebook group, within the Orderly Meds Facebook group, within several other content creators that I love to watch. For example, yesterday on Man on the Pen, he broke the news on ProRx. And so I went back, and which I might touch on, but the point of me telling you this now is I went and read the letter that the FDA issued to ProRx. And so I went on his channel, and I was like, Dave, let's chat about this stuff. And so I posed my questions, and he responded back to me politely and answered. And then I was like, well, what about this and this? And we had this great conversation. Finding those people that are able to logically speak to you and not attack you about weight loss is so important. So again, I ask you, what are you waiting for? I think that the producer's story was such an important way to start this, because then she does go into some trials, right? Some you having trouble being received after weight loss. But Dave said the thing about him being empty when he would lose weight previously was so profound, because that is exactly how we all have felt. And you can't say you haven't. Come on, guys. I know you can't say that. I've lost a significant amount of weight in my life previously, and I felt awful. I felt out of control. I felt this overwhelming need to be able to control everything that I put in my mouth, or to out exercise everything that I was putting in my mouth, so that I can maintain this weight loss, so that I wasn't a failure, so that I didn't get told, oh, look, Brittany just gained all the way back again. I didn't want that. I didn't want to gain all the way back again and be a failure. And so that feeling of being so empty and so out of control with your journey was awful. And I don't feel that anymore. I don't have the need to fear that I'm not going to maintain my weight loss, because I know that I am, because I have this amazing tool, and I've made so many positive changes in my diet and in my lifestyle that I'm not gaining the weight back. I know I'm not. I can 100% say that I'm not. And I know so many of you feel the same way. So I want to know your thoughts on this down below. If you have watched this podcast, leave me your thoughts down below. I want to hear them. I want to have such an amazing conversation and elaborate further on this. Again, we can do so in my Facebook group. Also, if you want to check that out, it's always linked below. It's free. We have a lot of fun over there. And it's just great. So thank you guys so much for watching this video. I want to open up more mental health topics into this space, and because it is such a topic that goes so much hand in hand with obesity. So thank you guys so much for watching this video, and I will see you in the next one. Have a great day, guys. Bye.